It even appeared to some that she enjoyed calling the parents to let them know that their children died. If a baby's health was in poor condition, she would announce to the other nurses, "Tonight is the night." She would also always take a special interest in the children who were near death, always wanting to be there when it happened. Rumors started to spread that Genene was doing something to the children, but Pat Belko defended her, believing that what they said was purely just gossip from other nurses who were jealous of Genene's competence. But then a 6-month-old baby named Jose Antonio Flores came in with a fever, vomiting, and diarrhea. He was placed in Genene's care when he suddenly developed unexplained seizures and went into cardiac arrest. The doctors spent nearly an hour saving Jose, and thankfully they were successful. The doctors noticed that he was bleeding badly and were unable to determine the cause. They also discovered that his blood was not clotting. Whatever the issue was seemed to have resolved itself, and the baby appeared to be fine. Until the next day, during Genene's shift. Again, baby Jose started having seizures and began bleeding. During the early hours of the next morning, his heart stopped beating. The cause of death? Unknown. The doctor had the unfortunate task of telling the parents of their son's death. As he told Jose's father, the man had a heart attack. As Genene helped the father to the emergency room, she allowed Jose's older brother to carry the baby's body. Then she grabbed the baby from the boy and ran quickly down the corridor. Several members of the family chased after her, but she lost them and continued down to the morgue. No one could understand why she was acting in this way. But blood testing on the baby showed that Jose had an overdose of heparin, an anticoagulant. No one had ordered the drug, and the baby did not need it. So why was it in his system? Immediately, Genene's superiors became suspicious. 2 resident physicians who were treating 3-month-old Albert Garza found that Genene probably gave him an overdose of heparin. When the physicians confronted Genene about it, she became angry and left. Miraculously, the baby recovered soon after her absence. This led to tighter control over the staff's use of heparin. Nurses were held to be more accountable and precise in their record keeping. Also, children whose health declined while on the ward would be subject to extra lab tests. Dr. Robotham began to complain formally about Genene Jones. In November 1981, the hospital administration had a meeting. They did not want to conduct an internal investigation of the pediatrics ward and concluded that Dr. Robotham was just overreacting. The hospital was struggling and could not afford these suspicions to be brought to the public's attention. They didn't want that bad press. As such, they declined to follow through with the accusations. Dr. Robotham continued to try and launch a formal investigation and keep track of the 3 to 11 shift Genene worked. As heparin was now closely monitored on the ward, suddenly another drug showed up in the death of 11-month-old Joshua Sawyer. The baby was brought into the ICU after suffering from the effects of smoke inhalation after a fire at his home. He had a cardiac arrest and doctors ordered Dilantin. While he was in a coma, doctors expected him to make progress. But Genene told his parents that he would be better off if he was allowed to die, because he surely would have serious brain damage. Suddenly, Joshua experienced 2 heart attacks and died. The lab tests showed that there was a toxic amount of dilantin in his blood. It was apparent someone's handling of the drug had killed the baby, but the results went virtually unnoticed. Then Genene became aware of the fact that many of those who had always supported her at work were now growing increasingly suspicious of her. This is when she decided to turn to blackmail, telling her colleagues that she had records of every child that had died at the hospital and knew which doctor had killed them. Dr. Robotham went to the administrators requesting that Genene be fired, but no one listened. But the doctor wasn't the only one they were ignoring. They also chose to ignore a nurse who continually reported supplies that were going missing. Then another strange occurrence happened. 1-month-old Rolando Santos was being treated for pneumonia. Suddenly the baby began having seizures, cardiac arrest, and extensive unexplained bleeding. All of his symptoms developed and intensified during Genene's shift. Rolando began urinating so badly that he actually suffered from extreme dehydration. While Genene was off for 3 days, the baby dramatically improved. But on the day she returned to work, the baby began hemorrhaging, and then he had a heart attack. Lab tests performed on Rolando showed that he had an excessive amount of heparin in his system. A different doctor took over the baby's care, but Genene was still able to get to him, and his condition worsened yet again as he went into a coma. Blood came up into his throat, and his blood pressure dropped to dangerous levels. A doctor was able to save the baby, and he was removed from the pediatric ICU and placed under 24-hour surveillance. Due to the increase in security around the baby, his health improved well enough for him to be released to his parents. Another doctor went to the hospital administration to tell them that Genene Jones was killing children. He claimed to have found a manual in Genene's possession on how to inject heparin without leaving a mark. The doctor also stated he had evidence of how Rolando Santos had suffered only while Genene was on duty. But still, the hospital did nothing. Another child was sent to the pediatric ICU to recover from open heart surgery. He progressed very well after surgery until Genene arrived for her shift. He then became lethargic and his condition deteriorated, leading to his death. The doctors were baffled by the child's sudden health decline and death. The only thing they could attribute to this outcome was some sort of infection. Then everyone witnessed Genene grab a syringe, squirt fluid over the boy's forehead in the sign of a cross. Then she repeated it on herself. She then grabbed the boy and began to cry. More and more doctors complained to the administration about Genene. Eventually, a committee was formed to look into the problem. Pat Belko and James Robotham were put in charge. An outside team of investigators came in and found that there clearly was a problem within the hospital. However, they refused to pin all of the blame on one nurse. So the committee decided to replace all of the LVNs on the unit with RNs. This meant that Genene would be transferred away from the babies. But Genene did not take this news very well and resigned. The administrators were relieved because, to them, with her resigning, it took care of all their problems. But just because she resigned does not mean the problems she caused would stop. She could easily find another job and continue harming children. The emergencies and continuous resuscitations just started up somewhere else. Dr. Kathleen Holland opened a pediatrics clinic in Kerrville, Texas in 1982. as she needed help managing patients and such, she hired Genene Jones. Dr. Holland worked with the nurse at Bexar County Hospital and had even testified on her behalf during the investigation. The doctor was even warned not to hire Genene, but she still did because she thought that Genene was merely a victim of the male-dominated medical patriarchy. She thought the nurse was more than qualified and she just needed a chance. It was reported that Dr. Holland helped Genene move to Kerrville and even rented out a room to her and her 2 children. But just a few months after Genene left Bexar, someone found something alarming. A novel, The Sisterhood by Michael Palmer, was found with Genene's name on it. This book is about a group of medical professionals who pledged to end human suffering by terminating patients who believed would be better off dead. Of course, in the book, there was rules about what patients they would go after. And of course, because it's a story, one of them takes it too far, right? But still, it's kind of weird for a pediatric nurse to have a book like this, especially with all of the allegations against her. Many parents in Kerrville were just ecstatic that Dr. Holland opened a clinic in their area. But that very first summer, during 2 months, 7 different children succumbed to seizures while in her office. In one instance, Genene told the mother that their child was just having a tantrum, something that almost cost the child her life. Dr. Holland transferred each of the patients by ambulance, never questioning the seizures or thinking they were suspicious in any way. Genene's accounts of the incidents always differed greatly from those of other professionals who were involved, one of which claimed to have seen Genene inject something into a child who then began having a seizure. The hospital staff knew there was something more happening at the clinic because of the number of children afflicted in that very same clinic. Also strange was how quickly they always recovered while in the hospital. Dr. Holland never really seemed to question Genene or grow suspicious of her. That is until Chelsea McClellan died while on the way to another facility. The doctor was obviously devastated, but wondered how this healthy child, who came in for a normal, routine checkup, just suddenly goes into cardiac arrest and dies. The very same day Chelsea died, Genene returned to the clinic to see another patient. The boy started having seizures and needed to be resuscitated. Luckily, the child stabilized, but the parents later stated that Genene seemed to be excited over their child having a seizure, happy even. Tests would later indicate that there was no reason for an unexpected episode. It was around this time that a doctor at Sid Peterson discovered an unusually high number of baby deaths at the hospital Genene previously worked at. This doctor brought this information to the attention of a committee, and everyone started to realize that Genene Jones was doing something to these children. The committee then brought Dr. Holland in and started asking her questions. One such question was if she was using succinylcholine. I'm sorry if I mispronounced that, but, some medicines are very hard to pronounce. But it is a very powerful muscle relaxant. She admitted that there was some in her office, but she did not use it. The committee then notified the Texas Rangers without alerting Dr. Holland. Dr. Holland then told Genene about the meeting she had with the committee. On September 27th, while Genene was at lunch, Dr. Holland examined the bottles of succinylcholine. Both bottles were nearly full, but one of them had pinprick holes through the rubber stopper. Holland confronted Genene about what she had found, And Genene could not provide her with any credible answers as to why there was pinpricks in the bottles and why some of it was missing. She had even suggested throwing the bottles away to avoid questions. This alarmed Dr. Holland, as it should have. However, something else would soon be discovered. The near-full bottles were actually filled with saline. Someone had been using a lot of this dangerous medicine. A medicine which could paralyze a person, but lay fully aware of everything, unable to get anyone's attention. Before Dr. Holland could do anything, Genene informed her that she had taken an overdose of doxepin, which is used for anxiety. Because she claimed to have taken an alarming amount, she would need to have her stomach pumped. But it turned out that she hadn't taken enough to cause that reaction at all. She took 4 pills, faked a semi-coma state, which forced emergency personnel to treat her. Soon, Holland found out that another bottle of the muscle relaxer was ordered, but it was missing. She fired Genene on September 28th and offered to help with the investigation. But the damage and reputation at the clinic had already been done. Families left her practice, and Sid Peterson Hospital suspended her privileges. Because she hired Genene, Holland was losing everything. Her husband even divorced her during this time. On top of all of this, she saw evidence that Genene was trying to frame her, pushing the doctor to fear for her own life, which is messed up, but she was warned not to hire Genene. And I'm not saying it's totally her fault, because no, it's not. I know she believed the nurse was just experiencing a rough patch, or, just wanted to help a friend and colleague out. I'm sure she did not foresee her life taking this horrible turn when she decided to hire Genene. On October 12, 1982, a grand jury in Kerr County organized hearings on the 8 children from Holland's clinic who had experienced emergency respiratory issues, including Chelsea McClellan, who was initially said to have died of SIDS. Her body was exhumed to examine the tissues with an expensive test that had just been developed in Sweden to detect the presence of the muscle relaxant. The test results showed that the children's death had been caused by an injection of the muscle relaxant. While it was easy to receive the proof they needed for these drugs, it was more difficult to retrieve the proof they needed against the nurse. After all, not many people had witnessed her injecting the children. And if they did witness her inject the children with something, how can you prove that it was this harmful drug? In February 1983, another grand jury convened in San Antonio to look into 47 suspicious deaths of children at Bexar County Medical Center Hospital. All of these deaths occurred during the 4 years of Genene's employment and work schedule at the facility. The jury even received plenty of testimony from staff about Genene's behavior, but still, there wasn't any concrete evidence. 3 former Bexar employees, including Genene, were questioned by both grand juries. Dr. Holland would also be questioned by these juries. Chelsea's parents named Holland and Genene in a wrongful death suit. Holland had turned against Genene by this point and offered the district attorney information regarding the bottles of muscle relaxant in her office. At some point during all of this, Genene married a 19-year-old boy. It is speculated that her reasoning for this sudden marriage was to prevent tabloid rumors that she was a lesbian, which I don't see what that really has to do with anything, but okay. I mean, I know it was the 80s, but still, what does that have to do with anything? She was then caught trying to flee with him. The Kerr County grand jury indicted Genene Jones on 1 count of murder in Kerr County and several charges of injury to 7 other children who had been injected with the muscle-relaxing drug. For these charges, she could possibly face a sentence of 99 years. She was held in the Kerr County Jail with a $225,000 bond. In November, the San Antonio grand jury indicted her for injuring Rolando Santos with a deliberate injection of heparin, which he nearly died from. Genene still remained a suspect in 10 other infant deaths at the hospital. Administrators at the hospital were appalled by the findings. But they were also just really embarrassed because they knew something was going on, but they never acted to prevent it. They never investigated it, and they never tried to stop it. While awaiting trial, Genene claimed that she was receiving death threats. But the notes she showed people were strikingly similar to her own handwriting. Her trial was moved to Georgetown, Texas, and her attorney asked to be replaced. Genene would provide interviews to reporters, undermining his attempts to build a defense. There were 2 separate trials. The first trial started on January 15, 1984, for the murder of Chelsea McClellan and injury to other children. Prosecutors would claim that Genene had a hero complex. She needed to take the children to the edge of death and then bring them back so that she could be seen as their savior. Witnesses testified that Genene would often contradict herself, as she told one person she had injected a specific type of substance, but would tell someone else something completely different. Just in general, her behavior was entirely suspicious. What was even more suspicious, after learning everything, was the fact that she was the one who requested for the educational seminar on the use of the muscle relaxant. But what caused her to create such chaos? Many speculate that she liked the excitement and the attention it brought her. The risks she took and the things she had done was against children. They couldn't tell on her. Most of them were too young to speak. So the nurse was free to create emergencies over and over again. It stated that it was Munchausen syndrome by proxy, receiving attention from doctors by making someone else sick. So that's how she received attention. Much of this was played out again at the second trial, but this trial was more specifically surrounding Rolando Santos. And during this trial, a statistical report was presented showing that children were 25% more likely to have a cardiac arrest under Genene's care and were 10% more likely to die. A psychiatric exam performed on Genene failed to provide her with an insanity defense. Her lawyer would instead bring in witnesses to testify that she was competent, devoted, and responsible. The first jury deliberated for 3 hours. She was found guilty of the charges, convicted of murder, and was given the maximum sentence of 99 years on February 15, 1984. In October, she was found guilty of injuring Rolando Santos by injection. The 2 sentences totaled 159 years, with the possibility of parole. But what about the other suspected deaths? The staff at the Bexar County Medical Center Hospital shredded 9,000 pounds of pharmaceutical records, destroying any potential evidence that could have been used under the grand jury's subpoena. Many of those at Bexar who had protected Genene all those years ended up resigning. Dr. Holland's clinic also settled the legal lawsuit that the McClellans brought. After serving 10 years of her 159-year sentence, she came up for parole. relatives of Chelsea McClellan successfully fought to keep the nurse in prison. In 2018, Genene had been scheduled for mandatory release due to a Texas law that was meant to prevent prison overcrowding. To avoid this outcome, Genene was indicted on May 25, 2017 for the murder of 11-month-old Joshua Sawyer. Bexar County District Attorney stated that additional charges could be filed in the deaths of the other children. This was done to prevent her from being released. A judge in San Antonio also denied a request to dismiss 5 new murder indictments against her in April 2018. On January 16, 2020, Genene pled guilty to the murder of Joshua Sawyer on December 12, 1981, as part of a plea deal in which 4 other charges were dropped. For this, she was sentenced to life in prison. Genene Jones will not be eligible for parole until she is about 87 years old. Genene Jones was convicted of the murder of 2 children, but authorities suspect that she may have killed as many as 60 infants and children during the 70s and 80s. If these numbers are accurate, this would make her one of the worst healthcare serial killers in American history. What did you think of today's case? Do you think Genene Jones received the sentence she deserved? Let me know your thoughts about this case in the comments. Don't forget to like, follow, or subscribe for more stories like this. Thank you for listening and your support. Stay safe, and I will see you for the next episode. Bye.